Good morning, Kim.
You're muted.
I'm there now.
Kim, good morning. I'm glad you are with us. We have 3 voting members. We need 2 more before we have a quorum. So we'll
Okay.
give it another, we're a minute before 9 anyway, so.
Okay. All right, I'll go grab a cup of coffee and be right back.
Okay. Good morning, John.
Good morning. I realize I left my coffee in the other room. I'll be right back, but I'm here.
A minute,
Ready to-
yep.
Great.
Same thing. I'm gonna go grab mine. That inspired me.
I think that's the trend this morning.
Essential ingredients for a good meeting. Melissa, I take back what I said a moment ago. I'll wait until we have a quorum and then I'll start the recording if that's okay.
We need 1 more voting member to have a quorum.
Great.
Kim, I believe the live stream is on. We're not yet recording the meeting, but for those who might be tuned in, we are simply waiting for 1 more voting member to arrive, and then we'll have the chairman start the meeting. And as soon as we admit her, we will be there. Okay, Kim.
All right, I'm looking to see who we've got. All right. You say we do have?
We do. We have 6 of our 9 voting members, so we are beyond the 5 necessary for a quorum.
All right. Delise was one.
Delise and Senator Erickson joined.
Oh, okay, I didn't see Senator Erickson yet.
I just got here.
Well, you're fine. This is one of those situations where I can only see 6 or 8 at a time, so I apologize if I missed you. Let's call the meeting to order then. Thank you, everybody, for being here once again to deal with the Children's Cabinet and Trust Fund meeting agenda. We have participants, I suspect, from all over the state as well, in addition to the cabinet, and we welcome you to our meeting. So first thing we need to do is take official action to look at the minutes from the December 2nd meeting that Dioga has circulated. Are there any additions or corrections to those minutes, or is there a motion to approve them?
If there's no changes, this is Leetta. I move to approve the minutes.
Thank you,
This is
Leetta. Is there a
Deanne,
second?
and I'll second.
All right, Deanne seconds. All in favor of approving the minutes, you may say aye.
I'm
Any opposed? All right, the minutes are approved and presented. Thank you. I think our next order of business is something a little bit new and different. Melissa, and are you going to lead us in that discussion of the supplemental award?
Yes, Kim, thank you, and welcome to everyone this morning. We received, when the American Rescue Plan passed, the CBCAP, the Community-Based Child Abuse Prevention Program, received a supplemental award from those funds that we have purposely held onto because we were participating as a state in a national cohort called Thriving Families, Safer Children, which we have touched on at meetings past. And we thought that because this was one-time funding of a supplemental nature, that we would see what developed through that work of Thriving Families, which is an initiative designed to help states begin thinking about child well-being as opposed to the focus on the concept of child welfare. So how do we move upstream to put policies and practices and programs in place that help with maltreatment prevention rather than waiting until something bad is imminent or has already happened to intervene? Not to say that intervention, once you're at that bad place, it is being downplayed, but how do we proactively begin to more intentionally work to prevent those bad things from happening and support our children and their families? And as that cohort has matured and we've worked through the work, it's been the Annie E. Casey Foundation that has been partnering with the Administration for Children and Families at the federal level. So it has been a public-private partnership. We have done some things with our regular CBCAP awards to work with award recipients as they are thinking about the programs and services they provide for their children. But with this supplemental funding, it is one-time funding, and we're mindful that there's that balance between do we add funding for additional services with one-time money, or do we focus that money on investment in things that will be one-time expenses and have a lasting effect? We chose to bring you a proposal for this supplemental fund to do something that is in that one-time impactful bucket. So what we are proposing is gathering up data that is publicly available to create a child and family well-being dashboard. You received a proposal in your board prep materials that outlines the details of what we're thinking, but it is a way of looking and utilizing data that is driven by well-being indicators, the menu of protective factors and identifying things that are helping in the arena of primary prevention and family well-being, rather than the traditional approach that is so often used, which is really focused on the deficits. So we think this will fill a gap for all of us engaged in this work. It would be a publicly available interactive tool that would allow communities to check in and see how they're doing, utilize that data and the resources on this dashboard as they write their own grants or put together community level plans. So the timeline would be that this calendar year would primarily be the research and development phase, the information gathering to gather up the sources of available data. And then we'd move into phase 2, which is the actual development and we would have it out there. We would be able to make improvements and make sure that there is access and awareness of this tool being available through communication efforts. So the cost for that 2.5-year budget is on screen. It's estimated to be $371,320. It would be the one-time CBCAP funding, and it would give us a tool that will last. We have available resources. It's estimated that ongoing costs to maintain this with up-to-date data and maintain the necessary technology will cost us no more than $75,000 a year, and we have a line item in the CIF budget for support for infrastructure, which was always intended to support this type of tools and resources. So I'm happy to stand for questions and allow cabinet discussion, let's open it up, Kim.
Yeah, let's see what questions we have.
This is Leetta. just a statement. I think this could serve well for providing data for writing grants. Specifically, a lot of times when school districts or even our church here locally and some county initiatives, when they've tried to have data to serve, write grants and plug in holes where you quite frankly won't get the grant without a data point availability. I think this would be could potentially be a great tool for that. So it sounds like a great idea to me, Melissa.
Thank you, Leetta.
This, Kim, my problem with things like this has been the ongoing upkeep. So you answered that, Melissa. I appreciate that. I'm not clear. Are we putting this out for bids for the development?
This would be developed internally using, correct me if I have this wrong, KU support team, but it's a tool called My Sidewalk that I believe would be utilized. So it's an in-house project.
So I'm not a software person, but the sort of software framework for doing this is sort of already developed. It just has to be tailored. Is that a safe way to think about it or not?
I believe so. Jackie, do you have insight into that? Okay.
Yes. Yeah. If I may, Melissa.
Yes.
Yes, we're looking, Kim, and not really looking at how we can make a dashboard as easy as possible, and not there's a lot of data out there, but it's a little bit like a treasure hunt of finding that and pull it together and having the contextual pieces behind it. So Leetta, to your question, we're really looking at how anybody who would want to look within their own area might be able to pull up a dashboard and a profile on the well-being in their community. The way that it would be sliced and diced would be somewhat dependent on what the boundaries that they're looking for and what the available data are, and how those come together. But Kim, I appreciate the question. We have zero interest in reinventing the wheel and really want to build on what's already existing and how we might be able to weave some of the existing parts together.
Thank you. Any other questions or comments? A few years ago, the Kansas Hospital Association, several people led an effort to do one on health matters. I don't think it's duplicative of this at all, but I do think that visiting with them about lessons learned could be very helpful, because my recollection is that if in addition to the update, there's also the need to create awareness of this, and there may even need to be occasionally, depending on how complicated it is. When you say dashboard, I'm presuming it's not going to be too complicated, but sometimes you may even have to occasionally do seminars for interested groups to help them, especially local communities. So I just mentioned that as I think it'd be good to visit with our friends at the Kansas Hospital Association and get their ideas on how to make this most effective. So
Thank you, Kim, for that. I just want to note that we are aware of the Health Matters database and do not feel that this will be duplicative.
Right.
There's focuses on a unique package of indicators versus all of the indicators. So if anything, it's complementary. But it is,
And would you say this is primary prevention?
Yes.
Okay.
Family well-being indicators. So it is a variety of things. Part of a family's well-being is, do they have the economic support, be it their own family income or access to supportive programs? Do they have, I can think of a whole universe of factors that cause risk. So we would be looking at it rather than how many are homeless. We would be looking at the strength of housing in a stock in a community or that kind of thing is my understanding. And again, we will go through a voyage of discovery over the course of the next few months to refine the indicators and information that will be wrapped in, working with a variety of partners. We welcome people who think they have a data set that is accessible, publicly available data that might be useful for us to be aware of. So certainly having those conversations with a variety of partners will be part of the agenda moving forward.
Okay, let's check one last time. Any further comments or questions? This does require action because
Yes.
it is a decision to spend supplemental money and fully budgeted, and then with as Melissa indicated, I guess not a firm commitment, but at least a direction that we would be continuing to support it financially. So this I think requires a motion. Is there a motion to approve this plan and authorize staff to implement it?
Hi, it's Delise, and so moved.
Thank you. Is there a second?
Leetta, second.
Thank you, Leetta. Further discussion. I got to wake John Wilson up here. I don't think he's awake yet this
Oh,
morning.
no, I'm here. This is one of those step up, step back moments, you know.
I'm teasing you, John. You're usually leap right in there on those motions. So I'm glad Delise and Leetta just came right up. So any further discussion? If not, I'm going to call roll on this one. And just for fun, we're doing this in a different direction today. So John Wilson,
Yes.
Tyler Smith,
Yes.
Terry Rice.
Don't see Terry on the call.
I hadn't seen her either. Delise,
Yes.
Deanne,
Yes.
Leetta,
Yes.
Senator Erickson,
Yes.
and myself, yes. So, all right. Well, I think it's good. I think it's a great decision. One-time use of money to a one-time semi-permanent to permanent resource. I think it makes a lot of sense. So I appreciate
Thank you.
everybody's support of that. Thanks for bringing it, Melissa.
Thank you so much.
You want to now talk about Executive Order 2301?
Yes, I thought this cabinet might be interested because we will be included in the work of the executive order, at least via appointment. I believe that the executive director is written into the executive order as a member of the task force. So I will be bringing you regular reports as this work commences, but I thought the cabinet might be interested in the initiative and the thinking behind releasing this. So for those who haven't heard, the first executive order of Governor Kelly's second term was issued on Tuesday, January 10th. It is known as Executive Order number 2301. It establishes the Early Childhood Transition Task Force, which is charged with reviewing the Kansas early childhood governance structure as it exists, doing a gap analysis, doing fiscal mapping work, and bringing together a group of stakeholders on this task force that can give some recommendations to how we better align and streamline the governance of the early childhood system. It is currently spread across multiple state agencies. We have been working in a very intentional way, particularly through the preschool development grant work as a partnership between the Cabinet, Department for Children and Families, Department for Health and Environment, and the Department of Education have been a team working on an organized group of activities that have been aimed at achieving better coordination among our agencies. I think the pandemic really laid bare the intense difficulty of moving proposals forward quickly at the what I've called at times the speed of business, when it was certainly during times of crisis. It is hard to turn the wheels of multiple state agencies in the same direction at the same time, at the same rate, and I will note, I think it's really important to note, the intention has been there to get these programs moving. Certainly the relief programs, there was a sense of urgency, and even with alignment in purpose and intention, it's still, you are dealing with so many different divisions and departments and legalities that our model, which is known as a coordinated model, is proving to be an impediment to progress. And so with participation from the agencies affected, from private sector stakeholders, and from subject matter experts, with direction, there will be a neutral third-party convener from out of state who facilitates the work. The governor attended the Governor's Council on Education meeting last Friday with press present. She made the announcement that she is moving forward with the Hunt Institute to facilitate the work of this task force. They have experience helping shepherd other states through this process, and can be that voice and source of expertise and the research that needs to live behind this, voice of lived experience from other state processes, to help keep us on track. So they will provide the staff support and facilitate the meetings. This is part of the Hunt Institute mission. Their grant funding allows them to do this at no cost to the state. So that is an added bonus, that this is part of the work they are charged to do. And I would note that just this week, Governor Mike DeWine in Ohio announced a similar initiative. So this transcends the political side of the equation. This is really about figuring out what the next stage of more streamlined approach to how we implement and administer early childhood programs. There are other agencies that may be involved because there are other pieces of programs that live within the universe. I can envision KDADs, corrections, commerce. There's any number of ways and reasons why we may need other agencies involved over the course of the work. The goal of the executive order outlines a process that will involve public engagement sessions, most likely over the summer months, and work to refine preliminary recommendations in the fall, so that as we close out the year and look forward to a new legislative session, there is a report from this task force available with recommendations on the path forward. There are a variety of different methods of getting to the governor's vision of creating a seat in her cabinet for early childhood. But I think her stated intention is to ensure that this is change that can be embraced by the stakeholders involved, that some ability to ensure that it lasts beyond political administration. And I think there is understanding that we need to build a level of understanding and support among lawmakers, so that there is some ability to make this, whatever this set of changes looks like, something that we can all agree on. So I am not in any way leading the work, so my ability to answer questions may be limited, but I certainly would be happy to open it up for questions and discussion, because what I can do is convey any questions back to the governor's office for response.
Well, let's see. Comments or questions?
Melissa, it's Lietta. Can you explain a little bit when you say we have a coordinated approach and how that is making it a challenge?
Sure.
I'm not clear what that means.
Great question. So there are 3 commonly accepted, and I'm using air quotes, models of governance for early childhood across the country. Generally accepted to be coordinated, consolidated, or created. Coordinated means you have programs that separate state agencies play a part in. So in Kansas, child care, the federal child care development block grant, which is a major federal grant of funding, the designated lead agency is the Department for Children and Families, that they receive that funding and administer that program. Child care licensing is a program that the Kansas Department for Health and Environment oversees in their Bureau of Family Health. But those efforts are supported by part of that child care development block grant funding, so it has to be transferred to KDHE. We have other programs at both of those agencies that touch on early childhood that involve things. That Head Start is at DCF. We've got a variety of maternal child health and home visiting and behavioral health screening type programs that are within the universe of the Bureau of Family Health. You then have the Department of Education, which is where parent education programs like Parents as Teachers, where you have certain, obviously preschool programs are part of the Department of Education universe, but there are services for children with special healthcare needs that both KSDE for children 3 to 8 are part of the Part B service program, and then which is a piece of IDEA. You've got Part C services at KDHE. We know that there are other unique programs that likely still exist within the universe of Department of Corrections that help the children of incarcerated individuals. There's a big voyage of discovery that needs to take place as we map out how money flows across these various programs and what has to happen to roll out a change of one sort or another, or streamline application process or whatever. Each of those major agencies has their own legal team. Each of those agencies has their own office of, whatever it's called, the fiscal side of things. There is an office of grants and contracts that DCF has, or there's the KSDE fiscal team. There's just this roadmap of different entities that every step of the way, when we say, for example, the child care provider bonus program that was announced in July took months of planning and coordination because funding was using pandemic relief funds received by DCF. KDHE was the agency using the licensing system to check eligibility and issue the check. It just was complicated. Some states consolidate and streamline to reduce the number of separate agencies involved, and some states are creating actual offices or departments for early childhood. So we don't know yet what will make the most sense for Kansas, but we know that a couple weeks ago, there was a national ranking of early childhood governance systems Kansas was 49th out of 50. The bottom 10 or so were all coordinated systems. So it raises layers of complexity to the process. People often complain about the bureaucracy that exists, the red tape that exists. This is one piece of it where even with the best of intentions, we are creating more layers of that. So I know there's always legitimate concern about, are we simply growing more of that government bureaucracy by creating something new? But it is the intention of this work to figure out how to simplify and streamline, and that will require some form of change.
I really appreciate you synthesizing that. I had no idea. And what was the study that we were ranked 49th?
You don't have
to, if you don't mind just sending that.
I will email a link to it. It escapes me right now, but I was really struck by where we rank in terms of, because it's the Bipartisan Policy Center that issued this study, and we will make sure to include a link we can post on our website in our news section, and we will email it out to cabinet board members. But it actually, as disheartening as it was to see us nearly at the bottom, it wasn't actually surprising, just given our lived experience as we have been navigating a lot of need to think outside the box and do things that are not things, the pandemic raised situations that were not the norm. So it's easy to go day to day the way business has always been done. It's easy to keep those things moving, but when we need to address something a little more quickly, and right now we are continuing to deal with a situation in the childcare sector that is proving to be a major challenge for families and for businesses in the state, as well as our childcare providers. So this is just part of trying to evolve and keep up with the needs of the stakeholders in the early childhood system.
Any other questions? Comments?
Kim, this is John Wilson. No question. I think just an additional comment is I recognize the tension that exists of it's collaboration across state agencies at the highest level and at mid-level that have allowed us to successfully land this first preschool development grant, to do the needs assessment that led to it, to update it, and to execute it. And so on one hand, the collaborative spirit of all the staff involved has been wonderful. And as you highlighted, Melissa, what got us here may not get us to the next level. And I think this task force is a recognition of that. And I also kind of want to preemptively acknowledge what many on this in this meeting or listening to this meeting might feel of loss of potential what they know. And but I really think that this is an important direct step forward, and something that really couldn't happen until now, given where we've been with the pandemic. And so I think it's a really important step, and have an enormous amount of respect for the Hunt Institute's work, and think that their bipartisan kind of pragmatic and practical approach to this will keep the temperature where it needs to be and keep the focus where it needs to be. So that's all I'll say.
Thanks, Sean. Well, I naturally have a couple of comments. First of all, I'm very pleased that the governor intentionally included the business community in the membership of the committee. I think we continue to see the need to engage more with them and to encourage their interest and support. Melissa, I hope you may be the right one But there are one thing about early childhood that drove me crazy was so few resources and so many groups and so many task forces working on things. I mean, it was just out of balance to the resources available. And I don't begin to know the number of things that are underway, but I know there's a home visiting study underway. I know that KDHE has got, I think, sort of major regulations they're looking at. We've got our own early childhood advisory committee with lots of good ideas. I would just encourage you as the person in the neutral corner here, if you will, to help the leadership of this group coordinate with those, because I would hate to see the things they're proposing and doing end up being completely out of step with where this goes, if that makes any sense.
It makes complete sense. I will reassure that the secretaries of DCF and KDHE are named in the task force order, and certainly Department of Education is also at the table. Myself, and then a group of positions to be drawn from the private sector. We absolutely will bring all of those resources to bear, because this process can't move as quickly as the executive order outlines any other way. So it will have to start with what we know and what we have going on already amongst our constellation of agencies, and then there will be, that is the purpose of the gap analysis, to identify the gaps that exist in what we know and what we're doing. So I appreciate that, and I will convey that sentiment on behalf of the cabinet.
I think it'd be interesting sometime to just see a list of all the groups.
It's a lot, isn't it?
Studying and advising, and there's
Yeah.
special groups and there are ongoing groups, and I think this is such a great possibility. I don't want us to lose the possibility of real movement forward here.
For sure. We as a cabinet should, the expectation is that by our April meeting, we will have the report out to you on the home visiting analysis that's underway. And that is an example of a system that, we talk about the 7 or 8 models of home visiting that are utilized in the state, but there are so many different individual programs that implement them. And then it's just that it's a lot to coordinate across multiple different programs. Just
they have different funding, and they have
yes,
different administrative homes in most cases.
Correct. So
I just think that's going to be a perfect example of,
it is,
of what you need to do something with, I think.
Yeah, you mentioned the KDHE rules and regulatory analysis that is underway. I'll talk in a minute about some assistance the cabinet is offering, and KDHE accepted. But yes, there's a lot of different work underway across all of our agencies, and I hope this can bring it all together to improve our approach to things. And I would point out that there is a section of our strategic plan adopted at the beginning of 2020, just in February, so a month before the pandemic was declared. The strategic plan was adopted by the cabinet and submitted to ACF as part of our preschool development grants. There is a section that speaks to this. That work got sidetracked to some extent in dealing with the situation that the pandemic created for early childhood providers across the state. We moved into coping mode and tried not to lose the thread of planning and futures level thinking, but a lot of the work was dealing with keeping doors open and keeping keeping as much progress as we could in protecting access to services. So this is an exciting next chapter that we will regularly bring updates to this cabinet. And I will say that structurally, the cabinet was formed in state statute, and by design, we have to have a memorandum of understanding with a larger state agency because we are not a big enough team with enough of a budget to do certain things for ourselves. So we started at SRS, Social and Rehabilitative Services was the name of the agency. We then, when I don't know, it's probably been 10 years now. It was 2016 when our MOU changed to DCF, but by then, or no, they changed to KSDE. See, it's very confusing. So when SRS was broken up, the cabinet MOU went with Department for Children and Families. So we were there for a while. In 2016, we got moved over to Department of Education, where our current MOU has KSDE offering us support for functions like the fiscal processing. When we award grants, I don't have a budget office that processes grants. It's KSDE Fiscal that provides that service for us. The IT services that we need are provided by their team. HR functions. So there's a menu of identified services in our MOU that they provide for us, and a couple things where it's clearly articulated they will not, they do not provide legal assistance for us, things like that. But we've had good working relationships with those agencies, but I mean, we as a cabinet, I think would, if there is a new division formed, a new agency, I don't know if we move or not move. That's one of those questions that would be part of the mapping of the task force and their proposals. So there will be some connection to the cabinet in all of this. So we will have regular updates as warranted.
All right, final chance for any questions or comments. I think it helped to go through that. Appreciate it. All right, Spark funding update.
This is a big one for the Kansas Children's Cabinet, and I am delighted to, at long last, have the opportunity to brief you on the plan for a portion of the Spark funding. The funding itself sources to the American Rescue Plan. It is part of the state fiscal recovery fund, which is discretionary funding the states received. In the American Rescue Plan, Kansas received, I believe it was $1.6 billion for this. We'll call it Spark funding. Spark is the acronym for the committee that was formed to make determinations and recommendations to the State Finance Council for how to allocate this discretionary funding. If you recall, the American Rescue Plan passed in, I think, nearly 2 years ago. So this has been a long, deep dive into needs assessment across the state, across all sectors. So there was a period of public input that closed a year ago, last February. There were statewide listening sessions taking input. There were subcommittees formed in 4 key areas, and that began to bubble up as the most commonly mentioned things. So those areas were economic development, health and education, modernization, and Senator Erickson, I will phone a friend. Do you recall the 4th? well, so there were 4 key buckets. We early childhood services were part of health and education. And so there has been analysis of the public comments. There has been meetings and lots and lots of thought given, planning done. And after our December meeting, just before Christmas, the Spark Executive Committee made a recommendation to the State Finance Council. And those recommendations involved tranches of funding, buckets of funding, as they were commonly referred to, that divided the available resources into programs and with identified agencies to administer each program. Out of all of that, and I will say a good chunk of the state discretionary dollars were utilized in concert with legislative priorities. There were choices made to shore up I believe the state unemployment insurance trust fund and do some big picture budget stabilization work to improve the fiscal health of the state through the legislative process. It left just shy of $400 million to allocate. I think it was 375 million-ish. Out of that, child care needs were identified as one significant priority. The cabinet was named to receive $20 million of this funding to be used for grants to communities to fulfill construction needs. So it could be greenfield construction or major renovation, but this is funding at long last that can be used for the specific purpose of construction of new facilities. That is rare. This is the first source of funding that I've encountered in my 4 years here that allows this as an available use. So we are going to leverage it to the maximum extent possible to give grants. Through the idea submission process, there were over, I think it was $93 million worth of ideas submitted from communities across the state. And I can give examples of communities where their ask was 20 million or 25 million for their projects. So we will be unable to create a grant program with $20 million that fully funds, I think, most proposals, but we are certainly going to our desire is to leverage this funding as a catalyst for the completion of fundraising efforts and the ability to break ground and begin the work. This is a project known as the Child Care Capacity Accelerator. We are also really delighted and appreciative that DCF has made available. We have an interagency agreement in place to receive $20 million from the Child Care Development Fund, ARPA funding, that will marry up, supplement the 20 million in construction funding. The CCDF ARPA funding will be used to also include startup resources, capital, so that as we are building new facilities, programs are put in place to ensure that doors open successfully, that programs are fully staffed and trained, those classrooms are outfitted with the right curriculum materials and equipment to make them good, high quality environments, and that there is the ability for a program to get off the ground as they are enrolling families in services. So it is an exciting opportunity. We intend this to involve a single application process. So there is, it will be an online grant portal that will allow, as always, we will look for community partnerships. We will have criteria in place that achieve the program goals of accelerating the process of expanding the number of affordable licensed childcare seats through the very last mile, or creating catalytic funding that might be, match funding that matches private sector dollars. Certainly private dollars will be needed. We want to build a thriving and sustainable childcare ecosystem that leverages a number of all of the projects, Kim, that you identified that we are engaged in. We have been doing family navigation support. We have a Go team that is a targeted effort to support communities with technical assistance. We have quality improvement resources happening through the QRIS system known as Links to Quality at DCF. We have Child Care Aware engaged in communities in action workshops and community outreach and supports. That we have our own Kansas Professional Development Career Pathway and the Workforce Registry for childcare providers. All of these things are intended to be drawn in as resources available to these projects, and targeted technical assistance will be provided through the cabinet to support communities, make sure they are aware of the resources available. Our partners will be at the table. That is the purpose of the Go team and Child Care Aware's role. So we will be leveraging all of that existing work, bringing support to communities so they're not walking the path alone. The outcomes that we hope to see and will be monitoring through our usual type of evaluation and reporting will be increasing the number of licensed childcare facilities across the state, increasing the number of licensed childcare seats in programs, increasing and supporting the recruitment and retention of childcare providers, and improving across Kansas communities of all stripes, so rural, urban, suburban, whatever. We want to see improved access for Kansas families and improve quality in the process. So what we intend to do, and we are launching with this meeting today, is a window of time for, it is a call for letters of interest, because we need some help gauging whether those programs that were submitted as ideas last year continue to be a valid, viable need that and it, is their intention that they will continue to seek to apply for these funds, or have they satisfied their needs other ways in the ensuing timeframe? So as of today, we'll be posting instructions on our website for a letter of interest that we are asking communities and projects to submit. And we will offer a window until February 20th at 5 p.m. For those letters of interest to be received. Next week, we will plan an informational webinar on February 9th at 1 p.m. And as always, we will post that as quickly as possible to our website, so people who cannot be with us live have access to that information. We will be using all of our communications channels. So it starts with this meeting announcement today, our website, our weekly email, our regular webinars, and all of the meetings in the universe of governance structures, social media, whatever listservs that we can be part of. We will be announcing this opportunity. And I want to be very, very specific that those applicants that, or those ideas that were submitted last year, those points of contact will be contacted directly with an invitation to submit their letter of interest. This letter will in no way affect the award, the review and award process. It is simply a fact-finding mission so that we can gauge the type of size of a review team and the type of support processing the RFP will involve. We are required by the federal government to offer a competitive application process, and there is a specific set of information and criteria that have to be included in that RFP that we post that were not part of the idea submission process last year. So those proposals are high level. If somebody submitted a year ago and nothing has changed, they still have that need for the project as they described it. What they submitted will be the foundation of an application, but it is not complete information. So we'll need detailed budget and different forms of assurances that grant criteria will be met. So we will post the goal, and this is tentative. We have submitted materials to the Office of Recovery this week with our project process proposal and the outline of all of this until they approve what we have, or we don't know if they will ask us to make alterations yet or not, but our tentative timeline is that March 10th, we will post the RFP so that the application is visible and available. And we will continue to offer technical support. We will have a unit of time for questions to come in and be answered before the application window closes on May 15th. We will put together a process that involves a review committee. Our intention is to have a blind review process because we want to be careful about conflict of interest. We don't want to have to seek review team members who are outsiders to the state of Kansas. I do think it's important that people have a feel for what Kansas level issues are and communities face, and some level of knowledge about Kansas specifically, but we want to be careful. We want everyone to have a fair shot at this. So the process will be blind, meaning that the name of the program and the community, the address is not going to be known to our review team because we want them to have the chance to review the content and quality of the proposal itself without any bias that, oh, this is a Southeast Kansas, or this is a Southwest Kansas, or, I know this program, they're really good, or any of those things. We need to remove that from the equation. So these will be redacted to make sure there's nothing that identifies the program and its location. Those reviewers will have a scoring rubric. We will involve folks that come from probably, well, not probably, we are proposing that Department of Commerce be at the table, given that they more often give grant funds that can be used in construction projects. And so we're seeking some expertise on how to approach that section of the application, make sure that we have all the proper information and assurances in place. Our goal is to bring the process will be for the review teams to review, and then much like our ECBG and CBCAP, we will bring a set of recommendations forward to you as the Children's Cabinet for review, discussion, and a vote on whether or not to approve the awards. So we likely will have a special meeting because our target is to get to awards being announced ideally in June, but again, we're still waiting approval on materials. We need to make sure that from the time we have that approval, if we have to adjust the timeline under that tentative bullet point on the screen, we will make sure to publicly convey any changes to what I'm announcing today. I don't know if we can meet our June regular board meeting scheduled deadline, but so with some forbearance that we may need to call a special meeting, I would hope that by our April meeting, we will have a handle on whether or not a special meeting will be needed to give as much advance lead time as possible to get a date that we can get all of you gathered to meet and make awards. So that's the overview. It will be really exciting to see these projects emerge and to be able to support communities. What we have learned through all of this is that we cannot impose one size fits all prescription for how a community solves their childcare issues. In some communities, they have classroom space, they have programs that don't have enough staff to operate. There are other communities that have outgrown their facilities and simply need to create more space for the childcare needs of their community. There's explosive economic growth across the state. We anticipate that these grants will most likely track along the same trajectory as some of those big employment projects that are underway. But again, that is a guess of where need is greatest, and the thinking has been going on at community level. I will open for discussion and any potential questions that you all have.
I'll bet we have a few.
I bet.
All right. Who wants to lead off here? Well, I mean, first of all, it is an extraordinary opportunity. And I appreciate your sensitivity to not muffing it. This is not, we need our best grant making thinking as possible. And we're talking about $40 million to make a one-time impact. That's a task for a grant maker. I assume these people are going to have federal audits. Is this money going to flow through and they're going to have a federal audit requirement? Because a lot of these small child care programs will not be there yet, Melissa. So I trust we'll warn them about that.
That is part of what's being developed. There's very careful consideration to all of the things that the strings attached to federal dollars. So we will want the applicants to give thought to whether this is a responsibility that they are capable of shouldering. It's why the idea of a community partnership is so important, because there might be a wonderful childcare provider who, as you appropriately point out, Kim, would not be positioned to do this on their own. So maybe it is, could be any number of local governmental entities who are experienced in managing federal funds. It could be foundations. There will be a listing of allowable partners and recommended partners. So
you might be able to allow fiscal agents, you think, for
I think we generally see that in our ECBG. Those partnerships usually have a single entity responsible for the fiduciary matters, and over certain dollar amounts, audits are necessary. So yeah, I mean, all of that is part of the detail going on in the background of this as we prepare to roll out the RFP. Appreciate that question.
Several communities. I have not followed Hutchinson, but it would still need to be redacted if I'm a reviewer. I haven't followed Hutchinson too much, but I will say this: a lot of thought and time and energy and the possibilities of how to pull this together at the community level has occurred. I think Hutchinson is far from alone in that. How do you see these community plans and efforts being taken into account inside these applications that may be coming from individual childcare providers? Can you help me with that?
Well, I think those are the communities who are probably the best positioned for this, those that have been engaged in community level planning and partnerships. This is a rapid timeline. We are balancing the need for appropriate planning with the need to award these funds to meet the deadlines for expending the funds, and construction will take some time. It's not like our normal grants where once we make the award, programs can engage in the work that they've been awarded the funding to do. The construction process will take time, and so we need to get these grants moving. So I think that as we know how many communities across the state are being supported by Child Care Aware in their community in action work. So we feel good that there is the ability for communities representing all areas, all the regions of the state are equipped to come to the table with the right criteria to be qualified to apply for the award. Part of it is also, especially in a rural setting where you just can't, you don't have the population to make the economics of a center-based approach work. There are creative ways that even in those communities, we have seen creative approaches to how you leverage the family childcare home license to create a expanded capacity. So it may be, some of those examples over time have been a single holder of those, a string of those licenses, hires staff and has separate sites in different home-based settings, but it is a business owner running that as a business. So I want to encourage that kind of creative thinking. Part of the work being done at KDHE to make sure there is a comprehensive review of childcare licensing rules and regs is thinking around a small center concept. So filling a gap between the home-based and the center-based, creating an approach for a smaller, viable model economically. So we are hoping to see innovative approaches and creative thinking brought to these awards, and we are confident that the work has been going on across the state all year or two as people work and struggle with the childcare needs they have.
Okay. Further comments or questions? Let me just be clear about this. The application itself and the qualifications and all that is not coming back to the cabinet under this timeline. Is that right? We will be presented with, based on everything, who's recommended to receive awards sometime at a probably special meeting in June for our action. Is that the way?
Yeah, I mean,
our role?
Your role is to receive the recommendations and make determinations of the awards. What I can do, I certainly would be happy when we have approval to post information from the Office of Recovery. I would be happy to make sure that cabinet members receive those materials via email so that you have awareness and don't have to go searching for them. We will continue to have direct contact with those applicants that submitted ideas last year in the public portal. We will certainly, for those who submit a letter of interest, we will communicate with them in response when we have the application materials ready to share publicly. This will be posted on our web-based resources. So we will, I will certainly make sure this cabinet maintains a strong connection to the steps in the process. But the decision-making role for approving those materials resides with the recovery office. So that's what this hinges on.
All right. Anything else? Signing opportunity. Appreciate your work on pulling it together. Look forward to the results. Agency updates. Is that unless I'm closing somebody out here? I was nervous because Tanya just sent a message to everyone. I was afraid that meant she needed to get off or something here. So I wanted to get the agency updates.
I still see Tanya in the meeting. Tanya, we've got the next slide has all the agency names if we could advance it. But Tanya, we could cut the line and let you go first if you have to leave.
No, I don't have to leave.
Oh, okay.
I just wanted folks to have the link.
Oh, okay. All right. I apologize. I couldn't see all that on mine at the time. I was afraid you were running out of time. So let's just go down the line and we'll give our staff member first billing here. Amy?
Good morning, Amy Meek with the Children's Cabinet, and happy to bring a couple updates to you this morning. One is about our early childhood block grant, which you heard about a couple cabinet meetings ago, and approved kind of our plan to put forth our RFP and our application. The application closed mid-December. And since that time, we're in the review process, both internally, and we have external reviewers for new applications that we received. So we'll be working between now and April to finish that up and then bring you a slate of recommendations at the April meeting for funding that will begin in July. And then the other thing that we've given a lot of attention to, and especially this past month, is the wrap up of our PDG subgrants. We have over 50 of those subgrants. Some of those have been multi-year, almost 3 years, and we've had some that have been 1 year kindergarten transition awards. But those, all the money needs to be spent out by April 29th. And there's been some challenges sometimes with those budgets and plans that the subgrantees had in place, especially with staffing or supply chain and things like that. So the approach that we took was to have one-on-one meetings through Zoom with them. So we've had over 50 of those to touch base and go over their plan for between now and the end of April, how they're going to get that money spent, and talk through their challenges and how they can still meet the outcome of their overall subgrant with maybe changing up their budget and what they had planned to still spend those funds. These are some of our programs that we've that have these subgrants are fairly small. And this is kind of a unique funding for a lot of these programs to have this. It's not, they knew it was going to come to an end, and hopefully maybe on down the road, we might have these available, but we know we won't have these available for 2023, these subgrants. So we don't want to send any of the money back. We want them to be able to use the funds, and they certainly have a lot of needs out there. These are the subgrants kind of range from professional development, maybe implementing some new curriculum or family engagement activities, so forth. So those were really great meetings and good way to touch base and find out where everybody's at. And then they submitted kind of a written plan to us for how they're going to spend those funds. And then we'll continue to monitor to make sure that money all is spent out by the end of April, along with or reviewing all of our other PDG budgets and things that we had in place to make sure that we're closing that grant out. So Melissa's going to share a lot of other things that we're busy with in her director's update. So I'll stop there, and I will let you know Amanda Peterson is not able to be on this morning, but Natalie McLean is on in her place.
Okay. Well, anything else for Amy? All right, Natalie, we welcome you to the meeting. Thank you for joining us.
Good morning. Yeah, Amanda wasn't able to be here today, but I'm happy to fill in her information here. We just had two quick announcements. One was that the KPERC, which is the Kansas Parent Information and Resource Center, has distributed more than 45,000 copies of our kindergarten in Kansas booklets to different organizations serving families since we printed the updated version. And we're working on a repeat. We're getting ready for, a lot of programs are getting ready for kindergarten roundup coming up. So they'll be distributing a bunch more of those. Just a reminder, we had those translated into Spanish, Vietnamese, Swahili, Arabic, and Burmese, and all of those different languages are being accessed. So it's really awesome that we were able to get that many copies out. Also, the Kansas Preschool Pilot renewal grants applications are due by February 17th. We've decided to do a renewal of the grants that we did for this year to make that a little bit easier for programs. If programs have any questions or need any assistance with that renewal process, they can definitely reach out to me or submit a help ticket in the Kansas Common App. And that's all we had. Does anybody have any questions for us at KSDE?
Well, I have some, like, what's their total budget recommendation going to be to the legislature? No, I'm kidding.
I could definitely ask Amanda for you.
No, I was teasing you on that one. All right. Well, we thank you for filling in today. Anytime, join us. Appreciate it. If there are no questions. That kindergarten booklet strikes me as kind of exciting to get translated into all those languages. I congratulate you on that. That's wonderful. So, all right, Tanya, are you available? Maybe not. DCF report.
Well, it looks like Tanya did have to go. So DCF is excited to announce that they have made grant awards for funding to expand the network of family resource centers. Tanya shared a link to the announcement. I think it is 10 new for 10 family resource centers. It's $1.8 million in funding. I think they're partnering with Kansas Children's Services League, and it looks like awards were made to a wonderful group of programs geographically arrayed around the state. So there is a Children's Center in Douglas County, the Community Children's Center, Kansas Family Advisory Network Southeast, a collection of counties in Southeast Kansas, the Kansas Family Advisory Network Southwest, a group of Southwest Kansas counties, Kansas Children's Services League in Sedgwick County, the KU Project Eagle in Wyandotte County, Live Well Northwest Kansas in a group of Northwest Kansas counties, the Pony Express program in Marshall and Washington counties, Turner Unified School District 202 in Wyandotte County, the Urban League of Kansas for the 67214 zip code in Sedgwick County, and USD 252 in Lyon County, serving 3 different communities. So more detailed information is available in the link, which we will get posted to our cabinet website. I will quickly apologize for Justice Wall. He is in court today. The Supreme Court docket has them hearing cases, so he sends his regrets, and he had one update to share that they will be hosting a series of family law webinars, 4 75-minute family law webinars that begin at noon. Judges, court staff, and attorneys are welcome to attend. The first one was held on January 25th. Parental conflict and child development was the topic, and it will have different different breakouts and projects to engage in during the webinar to identify short, medium, and long-term effects of significant parental conflict on child development, assess the risk of alienating behaviors, and understand possible interventions and judicial responses in caustic family law cases. So that was number one. The next one will be May 24th, A Child's Voice in Court. September 27th, Mental Health and Family Court. December 13th, Family Court and Technology. And then they have juvenile justice webinars planned for this calendar year, 4 50-minute webinars on child toxic stress and its impact on youth who encounter the juvenile justice system. The webinars comply with the training protocol established pursuant to KSA 20-318A. Judges, court staff, and attorneys are welcome to attend. All of those webinars begin at noon. February 24th is Child Toxic Stress and Racial Identity and Discrimination. May 26th, Child Toxic Stress and LGBTQ Identity and Discrimination. September 22nd, Child Toxic Stress and the Foster Care System. November 16th, Systemic Considerations, a Trauma-Informed Approach. And a reminder or an announcement that Kansas Legal Services operates a grant-funded advice line to give brief advice to court patrons who have questions about legal proceedings, completing forms, and related topics. The phone line is 1-800-675-5860. We'll get information posted so people don't have to remember this, but Kansas Legal Services has business cards with information about the advice line that they can share with court patrons who are in the courtroom. If you would like business cards to share, you can email Cindy V, as in Victor, at klsinc.org. So we'll post those notices, but wanted to share that. And then Kim, I think that takes us, we need Kansas Department of Health and Environment. We need Allison Dalrymple. I think we moved past her.
I'm sorry, Allison. That was my fault.
That's okay, Kim. Not super big updates from KDHE right now. One that's exciting is Drew Duncan was serving as our interim bureau director in the meantime while we were searching, and we are proud to announce that we do have a new Bureau of Family Health bureau director. Will be starting in about a month. Her name is Dr. Jessie Piper. We also do have a new maternal child health Title V director, and that will be Dr. Jessica Miller, who will start here in just a few weeks. So lots of big changes happening here with leadership. And then I'm attending this meeting because Ashley's not here, but her and I will also try to tackle these together moving forward. And I will be on military leave for 2 months and have no access to any of my emails for 2 months here in just a couple of weeks. And so Ashley will be filling in the next few meetings for me, and then we'll see who will fill in from there. So I appreciate the support while we go through our change in leadership here at KDHE.
Well, we appreciate that in the midst of transition, you have been very good to stay involved, and good luck on your military leave. So
thank you, Kim.
Thanks a lot. And I again apologize for getting out of order. Well, I don't know. Carla, are you with us? I missed you last month or 2 months.
I know. I feel like I've been kind of out of the loop, but I'm sending a web link in the chat for our new Gen Ed program, and we refer to the discipline areas of buckets, but this is a pretty good graphic. It helps me understand the different things that we're doing. But one of the things that we're trying to accomplish is creating pathways for all students, high school students, and a lot of students don't really know where they're going in high school. So the buckets that we would create would be like a 6-hour bucket that would consist of public speaking and Comp 1. Those 2 courses are required for every bachelor's degree, every associate's. Sorry, my printer decided to print now. And even the applied associates. So then you would have another pathway, about 19 to 20 hours, where if you're looking at the buckets, you would see that, if they just take one course. The National Association of Concurrent Enrollment, the national group, says that credit with a purpose helps the students much better than just, they call it like current enrollment bingo, where students are just taking whatever and they have little courses everywhere, but they never get that straight line of gets them, the prize. So we're trying to focus and provide that. And the good news that I have that's very much related to early childhood is the Washburn Institute of Technology was approved to offer the early childhood education program for the Promise Act, which includes scholarships and the courses that I was talking about in the Gen Ed, those 2 courses would be part of that program. So that is exciting news that KBOR has related to early childhood. Any questions? And I don't know if I said that the Gen Ed pathways will go into effect fall of 2024. All of our universities and all of our community colleges will have a Gen Ed package that will transfer to each other, all of the institutions. So if a student completes their Gen Ed package and they go to KU or K-State, they do not have to complete any additional Gen Ed courses. This is huge for high school counselors and community college counselors, that they don't have to try and figure out, well, it depends on where you're going, what courses you need to take. So I know that's a little above the early childhood, but if we start young, maybe we'll get them on the right path.
Well, that would also mean that youth taking courses in high schools for college credit, that would guarantee them that even if they hadn't made up their mind where they're going, that it'll work. So
exactly.
I can see
Thank
that.
you.
Yeah. Well, that was probably obvious to everyone, but I just had to say it. All right. Anything else? Well, we're glad to always have you with us. Good things going on. Did somebody have something?
We still have Department of Corrections.
I'm going to let Matthew finish up here with our ex officio reports.
Thank you. So Kansas Department of Corrections, as well as the Juvenile Justice Oversight Committee, is announcing some new grant opportunities. We're taking that. We've always had grant opportunities that go directly to juvenile corrections advisory boards or to the community supervision agencies. But there's always some money left on the table because some counties don't apply for it. So we're taking that money and being able to provide some opportunity for grant funding directly to community agencies or behavioral health centers that maybe weren't able to get that through their local JCABs. So we're getting ready to send out like a big official flyer announcement about that. And so we can get that out there into the community and make sure that people know that those are available. At this time, it's still geared towards those justice involved youth, but the grants are available to be applied for now. If you have any questions about that, feel free to let me know. But I'll kind of send that out to you as well when we start rolling that out. We're kind of waiting for that final approval from the leaders to get that all that language approved of. KDOC has also started a contract with a functional family therapy approach for youth that are on supervision. It kind of trains our supervision staff about how to engage families, how to get parents involved in that supervision. You know, what's happening in the office with that supervision strategy is also happening in the home, and getting them more involved in that opportunity. Really, research has led that this has resulted in better outcomes, and that it becomes more of an engagement with the parents and the supervision officer with the youth, and not so much just the supervision officer. Because a lot of times what happens in the office kind of gets left in the office, and we're trying to kind of build some support around that. The Juvenile Justice Oversight Committee in particular is spending a lot of time on bills with the legislative session going on. There's a lot of bills out there that are changing that original Senate Bill 367 that created the juvenile justice reform back in 2016. So a lot of efforts being put into that. In addition, really working on getting some public information out. So last time I met with you all, I had a couple people reach out about some opportunities to spread communication. Thank you. I've kept that in my pocket. Unfortunately, I'm still waiting on those final approval for those communication pieces. And once I get that, I'll be reaching out to you. So I wanted to let you know that I haven't forgotten, and I do still appreciate that assistance there. Lastly, the Juvenile Justice Oversight Committee has put together a work group. I think last time we talked, it was the Opiate Response Network. That has kind of evolved into its own work group. And again, we're working with multiple state agencies, KDHE, KDADS, DOC, DCF, and kind of setting up a roadmap. And really the idea is that what can JJOC do to help that behavioral health in the state of Kansas? That seems to have been on a little bit of a decline, at least to the groups that we've already met with kind of agree that there's a lot of barriers that the behavioral health networks are facing. And we are trying to come up with some strategies and see what opportunities there are that we can help assist in that process. Of course, we're experiencing a lot of the same challenges that Executive Director Rooker talked about with multiple state agencies, and everybody has their own processes, and we're going to be doing a lot of work in trying to streamline that process. But overall, we're working towards being more community involved and getting more community agencies some funding to help with a lot of processes, as well as keeping up with the legislative session. So thank you for the opportunity for me to come here and hear from you and provide some updates on the correction side.
Sounds good, Matthew. I appreciate the partnership you continue to have with us. I think we all know that we've probably missed opportunities in past decades to really coordinate better. So we appreciate you and your agency working with us. Thanks a lot. So I am not shutting off. Should there be others who have reports before or comments before Melissa kind of gets into her closing update? I can't see everybody, but I'm not hearing anything. Go ahead, Melissa.
Okay, thanks, Kim. I just wanted to make the cabinet members aware that we did send you in your prep materials an executive summary PDF to the annual report. We will be posting, or if we haven't already during this meeting, it will be posted today on our website for public to access. The way I directed that executive summary be designed, it's actually a series of individual pieces that can be pulled apart on a couple different topics, so that it is useful in multiple ways. So it can live together in one document, or maybe we just need to show what the 2022 cabinet recommendations were for last year. That's one page of it that we can easily separate out and use as necessary, and so forth. So don't need any action taken, just know those materials are created and publicly available for use in whatever way it is helpful to all of you. We are excited that at the very tail end, between Christmas and New Year's, we were awarded, the announcement came that we received the full $4 million preschool development grant planning grant award. So as Amy detailed, the implementation 3-year grant is winding down with April 29th as the formal deadline for that particular grant project. This is new and different. This is money to go back out. The two specific deliverables required of every grant recipient will be a new comprehensive statewide needs assessment and an updated 5-year strategic plan for early childhood. So the intent is to allow states to take stock of the work that they've accomplished and factor in new priorities that have emerged or changing conditions on the ground. So we will be working towards getting both of those items produced as quickly as is feasible to do it right, so that we can move on to a couple other aspects of the grant work. Part of it is support for the childcare workforce. Part of it is improving parent engagement and support services. So we are excited at the chance to utilize this grant to do this assessment and to do it concurrent. I mean, the timing is nice with the work of the early childhood transition task force. I think we can help each other. I think that is our intent, that we, as Kim mentioned, make our resources available to that group and vice versa. We hope to have really good information gleaned from the gap analysis and fiscal mapping work that the task force will be engaged in. We think that will be helpful. So watch for those resources to emerge as the year progresses. It is a 1-year timeline for the planning grant, so it is a lot of work on a short timeline, but we are excited at the possibility. There will be some measure of concurrency with the implementation grant. Part of the assessment of spend down on that grant, as we look to whether we close out on April 29th or whether we seek a no-cost extension from the federal program to give us additional time for wrap-up work on implementation activities. I suspect we will be asking for an extension, so there will be 2 layers of work to track, but we have things organized and should be in good shape. Part of all of this new work that the cabinet is receiving and responsible for has led us to do some evaluation of the role and responsibilities of our existing cabinet staff. And I wanted to make the governing board aware of some adjustments that we're making to reorganize into a team that is equipped to manage a lot of new responsibilities. So number one, I am really pleased to announce that we are elevating Amy's responsibilities to absorb more of the administrative side of our portfolio of work, the usual CIF and our PDG work in particular. Lots of reports every quarter and annually, lots of things to keep track of. I need assistance as I step into an active role on the task force. We have the legislative session underway, lots of responsibilities landing on my plate. Amy's going to step in and act as something of a deputy for me in terms of keeping programs on track. Part of that involves, she has a seat on the early childhood recommendations panel as the cabinet designee. We have the cabinet vote to approve those appointments. What we are asking is permission to substitute Hannah White from our staff. She is our workforce coordinator. We think the work of the panel aligns nicely with the work to develop our career pathway, our workforce registry, and other workforce supports. So I am seeking approval from the cabinet to substitute Hannah in for Amy as the cabinet designee. The term will end in June, so this cabinet will make new appointments for the calendar year, the fiscal year cycle is what we use, July 1 through June 30th. So it's to finish the balance of this term, likely continue as our on our slate that we bring for vote. But I think, Kim, up to you if you need a formal vote or if we just seek unanimous consent might be.
Well, since that panel has really, they don't implement, they make recommendations
to us.
I'm comfortable with a consensus vote. Are there any objections to, I heard substituting Amy for Hannah. Did I get that backwards?
Backwards. Hannah,
Hannah
Amy's
for
currently, we're elevating Amy's role, so would
Okay.
like to include Hannah on the panel in her
So
place.
we would substitute Hannah for Amy for the period till the end of June, and then we'll take formal action to make
The full slate.
the full slate.
Yeah.
Are there any objections? I think hearing none, we'll treat that as effective.
Appreciate that. Dioga continues to be our heart and soul as our office manager, the key point person to support your work as cabinet members. She supports these meetings, takes our minutes, manages the public notices, all of the things that are involved with running the cabinet meeting and supporting you all as cabinet members. She continues to manage things here at the office for us and has some involvement with processing. She submits invoices for the CIF programs and things like that. So that's continuing, and we have Megan Broha serving as administrative support to a number of projects and positions in the cabinet universe. So she handles preschool development grants, support, administrative work, and things like that. We have a job posted to hire a program coordinator to absorb some of the work that Amy does with our CIF grant recipients. So that involves site visits and coordination throughout the year to make sure those awards are implemented smoothly. And the Spark program in particular, that federal package necessitates there is a heavy enough lift for maintaining compliance that we are engaged in a process of hiring someone with experience doing that that will be funded through the administrative allowance. There is 5% of the 20 million can be used towards administration. We anticipate in terms of staffing, I need somebody on point to manage that $40 million worth of funding overall. And then I think the balance of the admin will be judiciously used on reporting and evaluation of those programs and services. So minimal change to staffing to support a funding program that nearly matches the CIF in total. So I wanted to make this board aware of how we are reorienting the work that is handled internally. We issued, moving on to another set of updates regarding the universe of work, the child care workforce supports. The workforce registry contract was issued. We then had a period of time where we had to be responsive to the Kansas Information Technology Office with a detailed program plan and await review and approval. That came in, and that project in January officially got underway. So meetings are happening, planning is going on, the technical discovery work that has to happen is happening, and we are having regular updates. Hannah is managing that work for us, and it is exciting that this project is finally in motion. I mentioned already the home visiting update. That work is happening, and we will be talking more extensively about it in April. And that brings us to Dolly Parton's Imagination Library, which I'm really excited to show you the coverage map. We simplified it. We had a map that was designating by individual zip codes that was somewhat hard to read. This is by county. You can see the green counties are where we have full county coverage in the program. Yellow counties have certain communities that have a local partner, but not yet full coverage across the entire county. The two gray counties at the bottom are committed, and that means they have turned in the paperwork that's necessary and await. Usually at this stage, what we're waiting on is the U.S. Post Office to approve their application form for the nonprofit mailing rate. So we are excited to be launching very soon in those two additional counties. And then that leaves the blue counties. I believe there's 9 of them on this map that currently have no operational local partner. So we are engaged in effort to fill the gaps and bring the entire state on board with the program. That will happen this calendar year. And I think we are working to see if we can engage a partner willing to take on all of the gaps, or it, at least try and find some partnership to get this off the ground. But the other significant thing, and I guess in terms of enrollment, it's worth noting that on the most recent invoice, there were 48,820 children counted as receiving books in the round of mail that will land in mailboxes in a few weeks. So that reflects, since last month, 1,354 newly enrolled children receiving the first book in the program, which is The Little Engine That Could, as I designated as the first book because it's Dolly's favorite. I will say that there were 996 graduation books that were mailed out to children last month. So as we talk about growth in the program, remember it's net new totals that matter, because every month there are children aging out. They celebrate their 5th birthday, they get their graduation book and exit the program. So as we are signing new children up, we have children graduating, but there is really nice growth happening in this program. And I can't wait until we are set up to be able to do state level promotions. We are busy dreaming of the ways we can partner with a variety of different organizations, hospitals that have birthing centers, for example, and any type of organization that we can team up with. I'll be speaking to the Kansas chapter of the American Academy of Pediatrics, hopeful that we can forge some partnerships where we could supply them with informational material to hand out to families and do that kind of promotion where we can help raise awareness among parents. Part of that effort is the 501c3 authorization that we are seeking. I am delighted to announce that Representative Waymaster commissioned a bill draft and introduced it in House Appropriations about a week or so ago. And I noticed that on the legislative calendar for next week, it's on the agenda for a hearing in his Appropriations Committee on Wednesday, February 8th, I believe. And so I will draft some testimony in support of that. And I wanted to make this cabinet aware that there would be a public hearing in House Appropriations. We are hopeful that we can, the simplest path is to introduce matching a mirror bill, as it's called, on the Senate side and work it through the process and hope for clean bills that come out of both chambers that don't need to be reconciled with each other. But there's always that chance that the legislature has ideas of their own about the structure of this. The bill itself is limited in scope to the first clause authorizes the Children's Cabinet to create the 501c3 entity, and it names as the governance of the new nonprofit corporation, the membership of that board would consist of the members of this Children's Cabinet, the executive director of the Children's Cabinet, and other directors designated by the Children's Cabinet. So you all will maintain a level of oversight over the work of the nonprofit. And then the second paragraph simply defines the purpose of the nonprofit corporation. It shall be to receive gifts, donations, grants, and other monies, and engage in fundraising projects for the benefit of the Dolly Parton's Imagination Library book gifting program to develop, implement, promote, and sustain reading by the children of Kansas. So very limited in scope to simply being the fiduciary entity that helps us implement the program statewide in the manner that is actually required by the Dollywood Foundation.
Melissa,
I'll stop
Dr.
there.
Beth
I know there's
had a
question.
question. Yeah.
Yep.
I don't know if she still does.
Oh, hello and good morning, everyone. Melissa, thank you for your report. And I didn't mean to interrupt it, but
That's okay.
I am on the board with the Kansas chapter of the AEP. So if there's any support that I can also provide, please let me know.
Fantastic. We are starting with a run of bookmarks that the purpose is to share the QR code that parents would use to just use that code, and it takes you right to the registration site so that parents can sign their child up. I set up a table at the parent leadership conference in November to advertise to the parents in attendance, but we didn't have anything to hand out. So it occurs to me that that could be the sort of thing that would be handy to have to be a very simple way of communicating the opportunity. So we can talk more about that.
Yes, thank you. And also it's something that we would, if you have extras that we can put in our office, our respective offices to provide for patients as well.
Yep, that'd be great. So.
All right. Anything else, Melissa?
I think that's enough, Kim.
Well, we have time.
We do have time. We don't often have time for cabinet discussion that isn't part of, a specific agenda topic, but I would welcome the chance to hear any final thoughts or comments or questions from the cabinet. Any information you need me to bring back to you in the interim between now and April 14th when we have our next meeting.
Anybody? Well, it struck me that there are a lot of things to think about with the Spark funding.
Yes.
There are so many competing kind of issues. I mean, we have childcare centers in this community that haven't had a remodeling fund haven't had funds to remodel for 50 years, that serve lots of kids. They may not be able to serve more kids with the remodel. I don't know how you're going to weigh that. There are going to be people who want to run a childcare business and have not been part of a community planning effort at all. There are pluses and minuses about those people in my experience. So I wish you well in that final endeavor, because $40 million, and I guess I did understand that that 20 million of it could go to startup expenses or other things besides
Yes.
construction. Is that true?
Yeah, there's a list of allowable activities we have to stay in compliance with that the Child Care Development Block Grant funding brings with it. So yeah, there is compliance work with both sides of that $20 million bucket. It will be in trying to simplify the application process for the general public. It will be more complicated on the back end for staff, which is one of the reasons why we think it prudent to bring somebody on board. And we do have a candidate in the hiring process who brings experience in exactly this kind of work. So he holds a master's of public administration. He has job experience, and I think he is an appropriate candidate to take what will be a fairly complex administration role over the next, I think, the life of the funding. Forgive me, I think it's 2 years or potentially 3 for the Spark funding. So there is a lot to do to ensure that everything that money is used for is used in appropriately and is documented and in compliance, so that we do not run into issues with either the state single audit process, the federal audit. There will be multiple levels of auditing that happen, even just as invoices are introduced for payment. Each of those will have to pass an audit. So this is definitely a large enough project that it will be a full-time job to manage.
Well, and those grantees are not all going to be sophisticated, and they're going to need more help than usual. So I'm glad you're staffing.
Yeah, he will have a role in that technical support as well. So we're hopeful we come to terms and can get that new position onboarded quickly.
Anything else from the cabinet? Well, you go ahead. I interrupted you.
No.
Kim, this is John Wilson.
Yeah.
I was just, I know every year the cabinet makes funding decisions through our votes, and therefore may be subject to folks reaching out to us in hopes that we get support for their project. Like I know that's a baked in potential with our role, and I could see it, this being the case for this situation where there's local chambers, there's child care focused groups, there's other interested parties. I wonder if over time or quickly the cabinet can, or Melissa and staff can develop guidelines for handling kind of redirection so that we keep this a very pure process.
100% agree. I mean, I am already fielding such outreach. So yes, that is a terrific call out, John. We will, and definitely, why don't we plan to have some procedures that we can email out for each of you individually for where you direct inquiries for that grant program in particular, and I will share out the approved process plans with you as well, and make sure you know what's happening and how things will be handled.
Thanks, Melissa.
Thank you, John. Anything else? Well, if not, not seeing anything. Yes.
No, go ahead. I'm sorry.
Well, I was just going to say our next meeting is April 14th, planned to be virtual. The meeting schedule is up on the screen. Melissa has pointed out the possibility that we could have a meeting between June 2nd and August 4th to process some grants, depending on just how this Spark funding goes through, I guess. So
I just wanted to note April 14th is not the first Friday of the month. It's the second Friday. When we adopted the meeting schedule for 23, we noted the first Friday of April is Good Friday, and there was interest on the cabinet to having that day free for some of the travel and other observances that take place on that day. So April 14th is the second Friday. So it's the one meeting a year that is out of our typical schedule.
All right, if there's nothing else, I'll entertain a motion to adjourn.
I move that we adjourn the meeting.
John's moved,
Tyler Smith, second.
Tyler seconds. All in favor, say aye.
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 Are there any opposed? Let the record show it was unanimously approved. And thank you all again for being on today. Pretty quick, tight meeting, but some really exciting things. So appreciate your participation today, and look forward to keeping up with all these things going on. So have a good day, everyone.